So this is the sensory system disorders, part 3. I'm going to be talking about disorders of the ear. So first we're going to talk about types of hearing loss. You have conductive and you have your sensorineural. So with conductive, you can remember this one as the blockage. So sound cannot reach the inner ear. Common causes are a buildup of cerumen and otitis media, which is your middle ear infection with effusion. Other conditions are from foreign bodies, otosclerosis, and stenosis of the external auditory canal. And so then in the sensorineural, this is from a defect. So sound is conducted through the external and middle ear, but a defect in the inner ear results in its distortion. And this is usually caused by trauma, congenital conditions, and exposure to ototoxic drugs such as aspirin and antibiotics. So with conductive, it's a blockage, and with sensorineural, it's a defect. Okay, so they're going to test these hearing problems. They're going to use what's called the tuning fork test. And your two are the Weber and the Rhine. So in the Weber, when conductive hearing loss is present, the sound is louder in the affected ear. The patient does not hear ordinary background noise conducted through the air and receives only vibrations by bone conduction. So in the Rhine test and sensorineural loss, the sound is heard longer by air conduction, whereas in conductive hearing loss, the sound is heard longer by bone conduction. So here's the Weber one here. They're going to put the tuning fork on top of the head, and in the Rhine, it's going to be behind the ear and on the side. So communication with the hearing impaired, you want to remember to speak clearly, but do not over-accentuate your words. You want to speak in a normal tone, and do not avoid conversation with a person who has hearing loss. And to care for the person wearing the hearing aid, you want to make sure to wash the ear mold or plug daily in mild soap and water. If the hearing aid whistles, you can reinsert the ear mold. And you want to always keep extra batteries and cords available. So we're going to talk about 3 different disorders. The first one is acute otitis media. This is inflammation or infection of the middle ear. It is often caused by bacteria and additional sources such as allergies, exposure to cigarette smoke, mycoplasma, several viruses, or upper respiratory tract infections. And this occurs more in children because their eustachian tube is shorter and straighter, which provides easier access for organisms. Your clinical manifestation, so the patient experiences a sense of fullness in the ear and also has severe deep throbbing pain behind the tympanic membrane. So this severe pain, it may disappear if the tympanic membrane ruptures. So as you can see in this picture here, this is the ruptured eardrum versus a normal eardrum. So it's saying that the pain is going to disappear because once this ruptures, all the fluid and the things that were blocking it, it's going to start draining out of your ear. So that's why the pain is reduced. Okay, so for nursing interventions and medical management, a tympanostomy tube may be placed for a short or long-term use. And that's this tube right in here. And mastoiditis, it is an infection of the mastoid bones, and it may develop as an extension of middle ear infection that was left untreated or inadequately treated. So you always want to make sure that you go in for any type of ear infection because the infection could spread to your bone. And children are fed upright to prevent nasopharyngeal flora from entering the eustachian tube. So now I'm going to talk about otosclerosis. This is a chronic progressive deafness caused by the formation of spongy bone, especially around the oval window, with resulting ankylosis. So this is going to be stiffening and immobility of the stapes. So autosclerosis, it is a genetic disease. Women are affected twice as men, and frequently pregnancy triggers a rapid onset of this condition. So the patient will experience a slow, progressive, conductive hearing loss and tinnitus. And the deafness is usually first noted between ages 11 and 20. So for your diagnostic tests and medical management, so a pink blush called the Schwartz sign may be seen through the eardrum. The Weber and Rhine tests are done, and medical management, surgical treatment by stapedectomy restores conducting hearing loss. So in this picture here, it's just showing you that it's the pink blush known as the Schwartz sign. So your next major ear disease, this is Meniere's disease. It is a chronic disease of the inner ear characterized by recurrent episodes of vertigo, progressive unilateral nerve deafness, and tinnitus. So there is an increase in endolymph fluid, either from increased production or decreased absorption, causing increased pressure in the inner ear labyrinth. So they're going to experience attacks of severe vertigo, tinnitus, and progressive deafness, which results from this increased pressure, and usually only one ear is involved. So in this picture, you have a normal, healthy inner ear, and in Meniere's disease, you can see where it has the backed up fluid, and there's swelling, so this is going to distort information to the brain. Okay, so to confirm diagnosis, 2 or more episodes must be documented, accompanied by positive findings from other diagnostic tests. And there is no specific therapy for this disease. However, they will recommend fluid restriction, diuretics, and a low-salt diet in an attempt to decrease fluid pressure. And during an acute attack, you want to keep the patient in a quiet, darkened room. If the tinnitus becomes distressing, an increase in background noise such as music may provide relief. So that's just saying that if the ringing of the ears is too loud, you can put on some music to help drown out that sound. Okay, so let's go over some of the different surgeries of the ear. So you have the stapedectomy. This is the removal of the stapes, and you want to remember post-op that external ear packing to ensure healing. And the packing is left in place for 5 to 6 days. Patient's going to be on bed rest for the first 24 hours. You want to keep the patient flat with the operative side facing upward to maintain position of the prosthesis and graft. Headache, nausea, and vomiting and dizziness are expected. And you want to let the patient know that the patient's hearing does not improve until the edema subsides and the packing is removed. So the next surgery is tympanoplasty. It is any of several operative procedures on the eardrum or ossicles to restore or improve patients with conductive hearing loss. Remember, conductive is a blockage. So post-op, they're going to be on bed rest to the next morning, and you want to elevate the head of bed 40 degrees and keep the operative side facing upward. So a little difference between these two. In the stapedectomy, they're laying flat. In the tympanoplasty, they're at 40 degrees. So another thing they can do is the cochlear implant. This is the hearing device for the profoundly deaf. The implant is intended for the patient whose sensorineural hearing loss is either congenital or acquired. And the ideal candidate is one who became deaf after acquiring speech and language. Okay, so that ends part 3. Hopefully you have watched all 3 series of the sensory system. So go ahead and click on the sensory system test, and we're going to test your knowledge on what you've learned. Thank you for watching.